Mental health care in UK prisons. Agencies that act as important players in the mental health care of prisoners include HMPPS, which is responsible for the management and operation of prisons in England and Wales, the Ministry of Justice, which is responsible for prison policy, and the National Health Service, or NHS England, which is responsible for healthcare in prisons as well as in the general population. Under the Mental Health Act of 1983, prisoners can be admitted directly to a hospital for acute mental illness under Section 47 or 48. According to the House of Commons 2018 debate on mental health in prisons, the government set target for these transfers as 14 days. However, data collected as of November 2017 notes that 24% of transfers in the previous year had taken longer. Changing the Outlook is a policy document published by the Department of Health in 2001 that outlined changes in mental health services for prisoners. The World Health Organization and International Red Cross found in 2005 evidence that the experience of prison exacerbates mental health problems. A House of Commons debate on mental illness in prisons from 2018 backs up these statements using available evidence, however, also commenting on the lack of statistics on the number of people in prison that have a mental illness. The lack of control incarcerated populations have regarding their day-to-day life make it increasingly difficult to manage mental health problems. According to the House of Commons report from 2017 on mental health in prisons, this, as well as the lack of prison staff and increased prevalence of drugs, impact incarcerated populations' mental health. As of May 2019, the current prison population of UK prisons is 82,560. According to a 2009 study conducted by Elizabeth Walsh and Dawn Freshwater on the mental health awareness of prison staff, 90% of prisoners have a mental illness, personality disorder, and/or drug dependency. However, the study comments on the lack of up-to-date statistical data in this area, which is reiterated by the House of Commons debate previously mentioned. The House of Commons 2017 report states that the most commonly used estimate, the 90% of prisoners have mental health issues, is now 20 years old, and credits this to the ineffective screening processes. During an all-parliamentary group on prison health's visit to Winchester Prison, it was found that most mental health nurses were performing general duties as opposed to taking on mental health caseloads due to staffing shortages. On the other hand, in a report for the Prison Health Group on prison-specific competencies for doctors, it was found that many general practitioners have had no mental health training. A 2016 study on the equivalence of prison mental health care to that in the community by Graham Durkin found that although a new assessment and care-based approach had been introduced in many London prisons, much of the staff had still not been trained in mental health awareness. According to Durkin's 2006 study on equivalent care, mental health screening procedures for incoming prisoners have been reported to be ineffective and therefore result in a lack of identification of prisoners with mental health issues. Once in a prison wing, it is even less likely that the mental illness will be identified. Durkin also reports that although there are efforts to build an offender care system with good practices, the systems in place are not nearly as comprehensive as services in the general population. The House of Commons reports that continuity of treatment when released into the general population or moved to a new prison is lacking due to poor communication between service providers. In 1999, the NHS Executive and Her Majesty's Prison Service published a reform that highlighted the principle of equivalence between prison and community-based mental health care. However, according to both studies previously mentioned, this is not being achieved. In fact, the inequality of prison mental health care is well documented. One step toward changing this is the partnership agreement between HMPPS and NHS England. The partnership was renewed in 2018 with objectives targeting the reduction of self-harm, suicide, and substance misuse, as well as supporting the diverse needs of the population, creating policy focused on prisoner-specific needs, strengthening partnerships between agencies, improving data collection, and developing a more holistic approach to prisoner well-being.